Caribbean Public Health Agency, CARPA, was created to be a public health laboratory for the region, and it is therefore tasked with providing quality service to the territories of the Caribbean. However, according to Minister of Public Health, Dr. George Norton, the National Public Health Reference Lab was like a dream come true.
The National Reference Lab was probably one of the best labs in the Caribbean. Before CARPA, we could have been where CARPA is today. In the case of chikungunya, for instance, we had equipment in that National Reference Lab that could have tested for chikungunya. We hadn't the personnel. All we needed to do was to get somebody trained, and we could have had it done here. Things went downwards, where persons start leaving the jobs for different reasons. And we're in a situation now where we're not as good as we were before.
Chief Medical Officer Dr. Shamdio Prasad had stated to a popular newspaper that the challenges resulted in the diminished use of the laboratory, on occasion since it opened its door in July 2008. In fact, the laboratory during the course of last year was forced to halt its viral load of CD4 count tests, which are required to effectively assess and treat HIV/AIDS patients. Dr. Norton believes that the National Public Health Reference Lab should have never been in the state it is today.
We should have always been improving, and we should never have been in a situation where we have to send to Trinidad samples. I agree with that. That we should never have been in a situation where we have to send samples to test for H1N1, for chikungunya, for Zika. Never at all. Because we've been in a situation before where that would not have been necessary. Things went downwards, and now we have to do that. But we're hoping that we will get back soon, because we're having the necessary support.
The National Public Health Reference Lab was developed under the former PPPC administration. But according to medical workers, tests like Zika and the H1N1, etc., should have never been done in Trinidad and Tobago, but here. What are the support mechanisms that will be set up to put the lab on its feet once again?
We're in communication with CDC, we're in communication with PEPFAR, and already we have identified a director who's very much experienced, who is dedicated, and who we think will put that lab back where it is supposed to be and where it should have been. But things take some time. The supervision, the evaluation, we have persons in place who can do that.
Based on an intergovernmental agreement signed by the Caribbean Community member states, the Carper Laboratory was established in 2011 and became operational in 2013. Its establishment, in essence, combined the function of 5 Caribbean Regional Health Institutes into a single agency. Those agencies are the Caribbean Environmental Health Institute, the Caribbean Epidemiology Center, the Caribbean Food and Nutrition Institute, the Caribbean Health Research Council, and the Caribbean Regional Drug Testing Laboratory. As part of the laboratory, Guyana, like other member states, makes annual subscription contribution. According to Dr. Norton, the lab is functioning, but when it is properly recovered from its slumber, Guyana may not have to send tests to CARPA ever again, as all will be done right here in the country. Andrew Weeks reporting for Safe TV2 Headline News.